by Van Elaine Terrazola. Senator Grace Poe on Thursday joined her colleagues in prodding health officials to closely monitor children who have received the anti-dengue vaccine, which, recent reports bared, increases the risk for those who were not previously exposed to the mosquito-borne virus. Senator Grace Poe, PNA Photo, Manila Bulletin. It is important to account for children who received the vaccine amid new developments on its effects. Strict surveillance must be established to monitor any adverse effects and ensure that proper assistance will be given to those affected, Poe said in a statement. The DOE should focus on the kids given the shots and determine if any medical intervention is needed, given the information about the vaccine's effects, she added. Several senators earlier called on the Department of Health, DOE, to launch an information campaign and monitoring for those administered with Dengvaxia, after its manufacturer Sanofi Pasteur belatedly bared that the vaccine, despite being commercially available, is not recommended for those without prior infection of dengue. The DOE, as the issue erupted, suspended the sale, distribution, and the ongoing vaccinations, while lawmakers called for an investigation into the $3.5 billion immunization program. Poe, who also filed a resolution calling for a full-blown Senate inquiry, said she wants to find out why the program was hastily approved, despite the vaccine still undergoing trials. Meanwhile, Poe said the government should create a comprehensive database of people who have been injected with Dengvaxia, including those who have not been infected and those who have had prior exposures. We also seek the assistance of local government units in disseminating information coming from the DOE and other government agencies. If any of these initiatives would entail costs, the government should be ready with the funds and resources because at stake here are the lives of our children, she noted. Poe also urged to the government to ensure that there will be no repeat of what she called an ill-planned immunization campaign. She told the DOE to exercise due diligence before undertaking such a massive program. Due diligence on the effects of the drugs should have been observed and clear lines of protocols should have been established before allowing vaccines to be administered to large groups, especially children, Poe said. According to the senator, the DOE should exercise more prudence before approving mass vaccination, especially that the agency is set to introduce new vaccines under its expanded program on immunization, such as that for Japanese encephalitis. Poe likewise said she believed that pharmaceutical companies should be held responsible for selling vaccines that are still undergoing clinical trials and should be held equally accountable for any problem that arises from their manufactured vaccines. The Senate is scheduled to investigate on the botched immunization program by the government on Monday. Tags: dengue vaccine, DOE, health officials, immunization program, Manila Bulletin, monitor, Poe prods health officials to monitor vaccinated kids, Senator Grace Poe.